Come in.
Hi, how are you?
Good, how are you?
I'm good. My name is Chris. I'll be your student nurse that will be taking care of you today.
Hi.
Let me just wash my hands and provide privacy for you. Can you please state your name and your date of birth for me?
Marina McNeil, 10/15/95.
All right. And do you know where you are?
School.
And do you know what year it is?
2015.
And do you know who the president is?
Obama.
Good. And do you have any allergies right now?
Nope.
All right. And are you in any pain?
No.
Okay, the patient is alert and oriented ×3. She is dressed appropriately for the weather. Her hygiene is good. Her affect is good as well. Also, her speech is clear, and she appears her stated age. So the first thing I'm going to do is I'm going to check your hair, check for any signs of lesions or any parasites. There's no signs of that. And then I'm going to test the cranial nerves 5 and 7. Can you please puff out your cheeks for me, smile, pout, and raise your eyebrows. All right, cranial nerves 5 and 7 are intact. Next, I'm going to check her eyes. If you could just look past my shoulder. Okay, her eyes are reactive to light. They're about 3 millimeters when they react to light. And then her sclera is also white as well. And then can you pull down your eyes for me? Her conjunctiva is pink and moist as well. Now I'm just going to check her skin on her face. Her skin is warm and dry. There's no signs of lesions or bruising. Next, I'm going to check her mouth. You can open your mouth and stick out your tongue. Okay, her oral mucosa is intact and it's pink. Her teeth are all intact. Her gums are pink and moist. Her tongue is midline. There's no signs of white patches. Her uvula retracts when she says ah, and her tonsils are a 1+. Next, I'm going to check her carotids. Alright, I would rate her carotid about a 3+, and then I'm going to check for any bruise present. Alright, there is no signs of bruise. Next, I'm just going to check her upper extremities. See, there's her skin is warm and dry. It's appropriate for her ethnicity. There's no signs of bruising, scars, lesions. Then I'm just going to check her brachial pulses. Alright, I would rate those a 2+. And then her radial, also a 2+ as well. And then I'm going to check for her capillary refill. Alright, less than 3 seconds bilaterally. And then can you go like this for me? And then there's no signs of clubbing as well. And then if you can grab my hands as hard as you can. And then her hand grafts are pretty equal in both her arms. Okay, next I'm just going to check her lung sounds. You can just breathe. Okay, lung sounds are clear in the anterior, and then while I'm here, I'm going to check her cardiac. So with my diaphragm, I'm going to go to the aortic, the pulmonic, the herbs, tricuspid, and then mitral. And then I would stay here to listen for the apical pulse for 1 minute, and then go back with my bell. Okay, the S1 and S2 sounds are normal. Now I'm going to check her lungs posteriorly. If you could just shift to this side. Okay, can you just breathe? Okay, the sounds in the posterior are clear. There's no signs of wheezing or crackling. And then I'm just going to check for her CVA for any tenderness. Do you feel any tenderness?
Nope.
Okay, other side. Do you feel any tenderness?
Nope.
All right, and then while I'm here, I'm going to check her anterior-posterior diameter, and it looks like it is a 2-to-1 ratio, which is normal. Okay, and then now if I can have the patient lie down. Okay, so I'm just going to auscultate her abdomen just to see, to hear for her bowel sounds. Okay, the bowel sounds are all present in all 4 quadrants. Then I'm just going to palpate for any tenderness, if you feel any tenderness.
Nope.
Okay, and then in the right upper quadrant is the liver and the gallbladder. The left upper quadrant is the spleen and the pancreas. The left lower quadrant is the sigmoid and the descending colon. And then the right lower is the appendix and the cecum. And then her umbilicus is midline, and so would her bladder as well. Then I'm just going to percuss for any tympany and dullness. Okay, so I hear dullness in the organs where the organs are present, and then in tympany I would hear hollow sounds. Okay, and then just have the patient sit up. Then I would check for her JVD, and there's no signs of JVD. And then next I'm going to check her lower extremities. Okay, just feeling for any edema, no signs of edema. Her temperature is warm as dry. Now I'm just going to check her popliteal. Popliteal is a 1+. Tibial pulses, the 1+ as well, and then her dorsalis pedis is a 1+ as well, and then I'm going to test if she's positive or negative for the Babinski test. Alright, so her toes curl in, so she is negative for the Babinski test. Now I'm going to have the patient stand up. Alright, if you can bend over and touch your toes. Assess her spine. Her spine is midline. And then next I'm going to have her perform the Romberg test, which would be her feet together, hands by her side, and she closing her eyes for 20 seconds to check for her balance. Balance is good. She passed the Romberg test. Last but not least, I'm going to have her walk to the door and back for the get up and go test. Alright, and her gait is good, and she passed the get up and go test. And that completes my assessment.